Okay, good afternoon everyone. So our topic for today is all about consumer health information. But first, let me know what is consumer health. What is consumer health? So consumer health, it refers to the well-being of individuals purchasing health products and services. So that's a consumer health. And why is consumer health important? So first, consumer health important is because it will help you to become a wiser consumer. And second, it will help you to make a wise decision when buying products or availing services. So, who is a consumer? So, a consumer, it is a person who chooses and uses product and services. So, consumer, no? So, ang consumer is, which is, tayo yun. Kasi as long as bumibili tayo ng mga products or pagkain or napa-medicine man yan, so as long as bumibili tayo, no, ang tawag sa atin ay consumer. So, and consumer health information, it refers to the decision you make about the purchase of product and use of health information and services that will have direct effect on your health. Health information is the data and facts you got from media and people, including the professionals and agencies. It is the process of assisting you to acquire the correct information and understanding so that you'll able to make wise decision about a certain health item. So, consumer health information, no? So it is important na kapag meron tayong gustong bilhin, especially mga gamot or pagkain, no? So, it is important na nakahon jud na po kung naa sa likod ng basahon na kung nakabutang ng mga health information dito sa likod sa product. Kay nakabalo no o naa tayong mga ingredients dito na mga ingredients dito na dili pwede sa to like sa mga ubang tao na sa mga allergies like ana. So, importante jud kayo na basahon bago ka magpalit sa mga product na gusto mong paliton, ay mapagkaon mo na mga medicine man na. So, it is important jud na kanawon nimo to ito basahon, hindi mo ito kung sa mga ma-benefits nimo sa katong nga product pag gamito nimo to. Kaya naman to. So, okay, let's move on to the ethical issues and consumer health informatics. So, we have a 5 guideline ethical principles from the basis for evaluating moral conduct and healthcare. So, first is the autonomy. So, autonomy, it is a self-determination, right to privacy, individual freedom, fundamental to perform consent. So, when we say self-determination, no? So, you have a freedom to make your own decision without external influence by others, no? So, like halimbawa, no? Kanang sa autonomy. So, nakaka-right na mag-make imuhang decision na imuhang iba na dili ka sa iba, mag-depend sa iba kana imuhang gid na decision ang masunod. Like halimbawa halimbawa nanganak ka na tapos mayroon ang doktor na kailangan ka i-CS. So, nasa imo kung feeling mo kaya lang man dahil mo siya normal. So, nakakarapat no nga mag-make og imong decision no. So, wala sila mabuhat kung mayroon ka nga dili. Kay syempre ikaw man masunod. Yung decision ang masunod na dili lang. So, muna siya ang autonomy. So, next is the veracity. So, veracity is telling the truth, keeping promises, open patient decision relationship. So, when we say veracity, it is all about telling the truth, no? So, labi na sa patient, nimo nang bawa nyo na kay patient na siya cancer. So, it's important na ituan mo sa iyahan, iingon mo sa iyahan na iyang sakit is cancer. So, dapat hindi ka mangati. So, karapatan niya na mabalaan ang tinuod no, nga maudod niya ang sakit para po para po na isalig sa imong ang patient nimo ba para para makabuo ka na. So, okay, let's move on to the Next reporter, Ms. Pia Marie Viñalada.
Thank you, Ms. Isa. So let's continue. Next, we have beneficence. Doing good, promoting the well-being of others, professional obligation to help those in need. So here in beneficence now, we're not just helping the patients but also promoting their well-being. Also acting in the best interest of the patients, doing what is best for the patients and promote the welfare for others. And also, healthcare provide the needs of the patients or guiding them. The persons or the patients are treated in an ethical manner, not only by respecting their decisions and protecting them from harm, but also by making efforts to secure their well-being. And beneficence is also the act of being kind. The actions that the healthcare or provider showing to the patients bring positive outcome for the patients. Next is non-maleficence, avoiding harm to others, protecting patients from danger, pain, and suffering, or Hippocratic oath. So here is, we should not allow harm to be the reason of the pain of a person or a patient, or the cause to a patient through neglect. Also, non-maleficent means doing no harm. Providers must ask themselves whether their actions may harm the patients either by omissions or commission. So we should know if the action that we do can affect or can give harm to others or not. We should know that the actions can also affect or can give harm to others. Lastly, we have justice, fairness, respect for equality of all humans, equitable allocation of scarce resources, consideration of social policy. So here in justice, no, ensuring fairness. So lahat ng tao is pantay-pantay. So pantay-pantay tayo in terms of health sa medical and health services. Kahit mayaman ka or mahirap is maraong tayong rights para sa tiang health or access sa mga medical and health services, access sa hospital to make sure that our health is okay or walang problema. And also, ensuring that every member of society has an equal opportunity to enjoy medical and health services based on the locations of medical and health resources on demand. So ayun nga, ma-enjoy natin yung medical and health services even if you're poor or rich. So lahat tayo is pantay-pantay. Healthcare Information System. A healthcare information system or HIS refers to a system designed to manage healthcare data. This includes systems that collect, store, manage, and transmit a patient's electronic medical record or EMR. A hospital operational management or a system supporting healthcare policy decisions. HIS, it is a system where the records of the patient is stored or piled up, the history or other information of the patients. It enables healthcare organizations to collect, store, manage, analyze, and optimize patient treatment, histories, and other key data. It keeps track of all data related to the patient, such as patient's medical history, contact information, medication logs, appointment schedule, insurance information, and financial account, including billing and payment. So, ang Health Information System or HIS is dito natin makikita lahat ng informations about the patients. Their medical history, contact informations, appointment schedule, or any other informations about them. So, dito natin malalaman ang lahat-lahat ng information about the patient in case na kailangan natin malaman. And also, it can help the patients in the future to know his or her histories about his or her health. Examples of health information system. So we have 6 examples. First, we have electronic medical record and electronic health record, practice management software, master patient index, patient portals, remote patient monitoring, and clinical decision support. The next reporter is Ms. Dikaila Oronos, will discuss the examples of health information system.
Examples of health information systems. Number 1. Electronic medical record or EMR and electronic health record or EHR. These two terms are almost used interchangeably. The electronic medical record replaces the paper version of a patient's medical history. The electronic health record includes more health data, test results, and treatments. So, electronic medical records, it is a collection of medical information about a person that is stored on a computer. Electronic medical records includes the information about a patient's health history, such as diagnosis, medicines, tests, allergies, and treatment plans. While the electronic health record or EHR, it is an electronic version of a patient's medical history that is maintained by the provider over time and may include all of the key administrative clinical data relevant to that person's care under a particular provider, including demographics, progress notes, problems, medication, vital signs, past medical history, immunizations, laboratory data, and radiology reports. The EHR also has the ability to support other care-related activities directly or indirectly through various interfaces, including evidence-based decision support, quality management, and outcomes reporting. And also, this is the next step in the continued progress of healthcare that can strengthen the relationship between the patients and the clinicians. The data and the timeliness and availability of it will enable providers to make better decisions and provide better care.